Yeah, what I'm doing here,
Yes.
this office is bearing a lot of activities.
Yes.
First, it started with malaria program. Then, under the malaria program, we were training also the traditional birth attendant, who takes also drugs outside to the pregnant mothers, and who encourages the mother to come for delivery. But those who cannot come, they conduct the deliveries in the community. We also train the village health committees. Those are the frontline health workers. We, the Southern Sudanese, we appreciate that if the donors could continue to assist, it should continue for some time till the government picks over.
Maternal mortality and child mortality specifically are quite alarming. Maternal mortality stands at the rate of a ratio. It stands at 2,054 per 100,000 live births, and child mortality as well stands around 105 per 1,000 live births. This is comparably is one of the worst across the world. And if you look at the region, countries like Kenya, Uganda, you'll find them with the maternal mortality, although it is bad, it is still quite low compared to South Sudan. And so it becomes one of the major priorities of the Minister of Health to improve maternal and child health, reduce these alarming figures, and this can only be achieved through two main things. One, to improve the infrastructure and to improve accessibility, and the third thing, which is actually one of the main pillars of health service delivery, is the human resource.
Malaria is endemic in over 95% of South Sudan, with the whole of the population considered to be at risk of malaria, with children below 5 years and pregnant women are the most affected. About 20 to 40% of the health facility attendance is due to malaria.
40% of our beds occupied in our hospital anywhere, they occupy because of malaria. And that's why malaria has become very, very critical and very serious to deal with. We're trying our best, but we still have so many challenges. One is the issue also of the human resource, like we talk about it, that can be managed and can effectively do the right treatment for the malaria in South Sudan. Lack of the necessary information with the mothers. Some of them, they don't know that it's critical to take their children to the nearest health facility in first 24 hours of the fever. So most of them, they come very late with the complications. Also, we don't lack a quality drugs assessment in South Sudan. Most of the drugs that is coming in is being given by non-professional people. And they give those drugs not based on the guideline that the National Ministry of Health or the National Malaria Control adopt.
The status and levels of the health facilities in South Sudan is worse and remains one of the poorest in the world. There are 71 hospitals in the country, a size of East Africa, with only 3 teaching hospitals, 7 state hospitals, 27 county hospitals, and 514 Payam health centers, with over 5,000 community clinics. Most of these facilities are in bad conditions, while the majorities are non-functional as they are in dilapidated conditions.
If we are talking about Juba Teaching Hospital, Malakal Teaching Hospital, Wow Teaching Hospital, and some state hospitals and some counties hospitals need a lot of work to make them a real infrastructure that will allow people to deliver effective health services. There are areas that do not have infrastructures at all, and for health in South Sudan is huge. Basically, if you talk about the accessibility, you can say that definitely less than 25% of the total population of South Sudan have access to the minimum basic health service, and this imposes a huge challenge for the leadership, for the government to be able, and the partners to be able to put in place and resources that will enable people who are involved in the health sector in South Sudan to be able to put in place basic infrastructure needed for the delivery of health.
Infrastructure, yes, one of the major problems. And as part of the 100 days program of the president, we have done the paperwork at the moment to construct about 100 health facilities over the next 3 years. And in the first phase, we're going to start with 40. And the work is underway now. We are making discussions with the companies who can actually be able to start the work. This is because if you don't have a reasonable infrastructure, even if you have equipment and a skilled personnel, still you will not be able to deliver.
The challenges facing the health situation in the country is still high and needs enormous efforts to be exerted to address this in the 7-month-old country. Access to health care since wartime has been very challenging in South Sudan. With the peace agreement signed in 2005, it was thought that the situation would improve, but it didn't happen.
When we started in 2006, the children that are fully vaccinated within international standards, they were at 2.7%. So we show the majority of our children, they don't fully vaccinated. But currently we are doing our very, very best to strengthen the API programs across all 10 states and the counties to ensure that the children have opportunity to be vaccinated. But nevertheless, the gaps are still too many to count. We lack human resources that are capable of coordinating and providing the necessary leadership at the state and the county, and most only at the PM levels. We also encounter the critical challenge in terms of the access to the health services. The primary healthcare services access, according to the Sudan Household Survey conducted in 2010, has shown 14% of our population, of the people of Southern Sudan, have access to some sort of health facilities.
Access to primary health care is still very poor in most of South Sudan, simply because of the physical difficulty of reaching a clinic. In the rainy season, it is practically impossible to travel by road. People must either fly or go by boat, but the majority of people cannot afford a plane ticket, boat fare, or the bus fare during the dry season. So many people are forced to walk to find a health clinic at least a few hours, if not 2, 3, or 4 days walk, which is so difficult when ill. If they are so weak they cannot walk, one of their family members must carry them in a hammock or a stretcher all the way to find a clinic.
Very little resources are being allocated to the health, and this should be a lesson for the leadership, at least to go for a budget declaration where at least a minimum of 15% of the total budget is allocated for health. We understand that we have challenges in Southern Sudan. You have security, you need to develop your foreign policy, you need to develop your diplomatic mission across across the board to be able to communicate with the rest of the world as a new nation. But equally, we need to put some resources in health. And so the government of South Sudan, the Republic of South Sudan, the leadership should increase the total budget allocation for health so that we are able to develop a minimum basic infrastructure needed for health. Equally, our partners need also to understand that without a basic infrastructure for health, we will not be able to develop and provide those basic services.
South Sudan is as large as East Africa with Burundi and Rwanda. The current health situation in the country is very challenging and made worse by the budget constraints, limited infrastructure, limited of well-equipped medical facilities, and human resource. Therefore, there is need to enhance service delivery, especially in maternal and child health. Let us all join hands in building a health sector that provides quality services in South Sudan.